Hi, everybody. I'm Cheryl Jackson, and I'm really excited to have with me today Dr. Lisa Fitzpatrick. She's the founder of Grapevine Health. How are you today?
I'm great. How are you, Cheryl?
I'm good. I'm
Thanks
excited
for
about.
having me.
Oh, you're welcome. I'm excited to do this interview because everybody's focused on the pandemic, but we can't forget that we do need our flu shots. So, why is it more important than ever that me and my family get the flu shot this season?
Well, you said it. It's more important than ever this year because we're amidst a pandemic. We don't know how influenza and coronavirus will intersect, whether or not they'll make people sicker. Every year, we like to encourage people to get the flu vaccine. But this year, because people could be at risk for coronavirus and the flu, it's really important. It's also important for our public health officials and for our healthcare workers because we don't want to overwhelm the healthcare system with people who are sick from the flu and sick from coronavirus.
Mm. Now, I know I usually get this thing every year, but is it necessary if I got it last year? Do I need to also get it this year?
Absolutely. Unfortunately, the flu shot is only good for that year.
Oh,
And even people who get the flu shot each year, it's not 100%. And it's important for people to know that even if you get the flu shot and it doesn't protect you from the flu, if you get the flu, you're less likely to have a severe case of the flu. So there's still a reason to get a flu shot, even if it's not 100% effective.
got it. Better to have something than nothing to protect me,
Absolutely.
right? Years ago, my husband's military, so he would get the flu shot and then immediately after get sick. I haven't had that lately, but I know people hate to get it because they feel like, oh, if I get it, I'm going to be injected the flu. Is that true? Will the flu shot give me the flu?
That is not true. And I get this question all the time. I have people refusing to get the flu shot because they believe it will give you the flu. Here's why it doesn't. And here's why people are confused by that. When we give a vaccine, the purpose of the vaccine is to protect you in case you come in contact with whatever that infection is. And so, in order for your body to protect you, it's like putting on an armor of some kind. So, the body has to become prepared in case you get the flu. So, the vaccines will show you something that looks like a flu. It might be a little piece of the flu that's dead, but it can't cause infection. But what people are feeling is the body getting ready to prepare for
Mm,
the event you actually encounter the flu. I sometimes tell people it's like a dress rehearsal. So you introduce the flu to show the body what to do in the
mm.
event the real flu comes along. But what happens when the body is preparing, you can have side effects. And some of those side effects are pretty unpleasant. Some people will have a fever. You can feel achy all over. And some people have trouble getting out of bed. But the difference is that usually only lasts a day or two. Whereas if you have the flu, there are people who can't get out of bed for a week or more. And some people have to go to the hospital. And then some people die of the flu. So it's very different than the side effects from the flu vaccine.
Got it. I've never had that experience, but I noticed that, it was required, that my husband did while he was military, and oftentimes he would. So, what about pregnant women? Because, they shy away from all kinds of medicines when it comes to pregnant women. Can they get the flu shot as well?
Absolutely. The flu shot is safe for women who are pregnant. In fact, we want to protect them because pregnant women are in a category of people who are vulnerable to infections. So it's really important for pregnant women to also get the flu vaccine, and it's safe.
I like it. And I'm glad we're putting this information out because all of these are myths that people kind of conjure up
Right.
in their head. So so where can we go to get the flu shot?
There are plenty of places to go. I think the most important thing for people to know, especially if you have insurance, is that your insurance company will pay for the flu shot. But a lot of places offer the flu shot for free. You can get them at pharmacies, often offer it. You can also call your public health department. If you don't know the number, you can get on the internet and just put in the name of your city or state and then health department and call and ask them where to get a flu. a flu shot. You can also ask your doctor's office. If you don't have a doctor's office, oftentimes in many places, there are health fairs or pop-ups in the community, and they're offering flu shots for free. So if you don't have a doctor, or if you don't have insurance, you just have to be a little bit resourceful to figure out where the flu shots are, but they should be readily available in most communities.
Absolutely. You'll see them at drugstores. You'll see them. I used to get mine done at the primary care office, but you could also reach out to AmeriHealth. The team at AmeriHealth is 202-216-2318. AmeriHealth Caritas DC team, they can help you also find somewhere to go to get your flu shot. Again, that number is 202-216-2318. AmeriHealth Caritas team, they can help as well. So what can I do this winter to stay healthy? Because I'm loading up with ginger teas and vitamins, all kinds of things, and I'm staying home, number one. But give us some tips on what we can do to stay healthy this winter.
This is such a great question, because this year more than ever, it will be so interesting to see what happens with our flu numbers, because the same way you prevent coronavirus is the same way you prevent flu. Mm-hmm. Flu is transmitted person to person. If you cough or sneeze, or let's say I cough into my hand and then I touch the doorknob and someone else touches it and touches their face. Mm-hmm. So the things we're doing, social distancing, wearing a mask, keeping your hands clean, not touching your face, those are all the same reasons, are the same ways you prevent flu as well. But you're asking a really important question about what you can do to make sure your body is ready to fight off the flu, or to assist you in the event you get the flu. And I think it's very simple. It's the things we talk about most often related to being healthy. So making sure you're getting enough to eat. And this is not junk food, candy, lots of sugar, sugary beverages. Those things actually create more inflammation in the body. So I'm talking about trying to get in as many fruits and vegetables and lean meats as you can, really reducing the amount of sugar. But exercise. So if you're not someone who exercises, even just a brisk or even just a walk, a few blocks, anything you can do to keep your body moving will also help you fight off infections. And then finally, you have to get enough sleep at night, because this is when your body recovers from all the activity, any assaults that have happened on your body, from being overtired or stressed. This is when our bodies recover. And so many of us don't get enough rest. And then finally, I would say just do things you love to do. So if you like to dance or sing or hang out with your friends and family, these are all things that help strengthen your immune system. So it's not so much about getting the special potion or the Instagram special you saw with a special toxin or potion that's going to help boost your immune system. You can start by just doing these basic things, and that will help you stave off the flu.
That's so good. Being home all the time now is really have to put in my mind to get out there and start walking and be active and stay away from sugar. All right. So if you don't have access to transportation to go get the flu shot, is there any way that that there's transportation? That's AmeriHealth question, right?
Yeah, that is an AmeriHealth question, and I would prefer they answer this, but I just want to say, for people who have insurance, it's really important to connect with your insurance company and learn about all the different things they provide for you with your health insurance, because a lot of people don't really understand what comes with having health insurance. It's not always just about if you go to the hospital, will the bill be covered? But health insurance companies do a great job nowadays of helping people stay healthy, helping them get to the doctor, helping to educate them about the kinds of things they should eat, how to interact with healthcare providers. So there's so many benefits with having health insurance, but you have to do your part. Call, and a lot of times they'll call you to let you know what's covered with the health insurance. If you don't get that call, you can call them and they can give you all this information.
Awesome. AmeriHealth Caritas DC also offers free transportation as well to your provider's office or to the pharmacy for all enrollees. Call AmeriHealth Caritas DC at 202-216-2318 for assistance. So if you're just tuning in, I'm talking with Dr. Lisa Fitzpatrick. She's the founder of Grapevine Health. I really appreciate all of this information. It has been so impactful for us. And family, go get your flu shot, okay?
Yeah, especially this year. Thank you so much.
I also have with me Keith Maccannon. He's the Director of Marketing and Outreach for AmeriHealth. How are you, Keith?
I'm doing fantastic. How about yourself?
I'm good. I'm good. So Keith, tell us where we can go to get flu shots.
Our enrollees can go to any of our pharmacies that are in the network. If they go to our website, there's a list of all pharmacies that will give them flu shots where they would normally fill their prescriptions. That includes all of the CVS locations, the Walgreens, and just about most of the community pharmacies that are out there throughout all wards of the city.
Wonderful. What's the number to call if they need to get that list?
They can call our community outreach team at 202-216-2318. And anybody they speak to can tell them how to access either transportation, where pharmacies are located, any information like that.
So what if we have viewers that might be, struggling trying to get transportation? Is there access to transportation if you are a member of AmeriHealth?
Absolutely. For all of their medical appointments, they certainly can call the number that I just said, and I'll say it again, 202-216-2318. And then typically we don't have transportation offered to the pharmacy, but for flu shots and those type of clinical type services, they can get transportation to any of the locations where flu shots are offered.
Awesome.
They simply call in, and many times that can even be a Lyft or an Uber, so there's not a lot of logistics to it. If they have more significant needs, like maybe they need a car seat or they have some kind of special needs, we can book specialty transportation for them as well.
Awesome. That number again, 202-216-2318. Thank you so much, Keith.
You're welcome.
I also have with me Dr. Tracey Davis. She is the Director of Pharmacy at AmeriHealth. How are you?
I'm very well. How are you?
I'm good, thank you. Thank you for joining us. So I want to jump right in. Tell us why it's important now more than ever for us to get a flu shot.
Well, I think the challenge is how people see the flu. Some people think it's just as like a really bad cold, but it isn't. The flu really can kill you. And last year, we had 5 times more people in the district die than people across the nation.
Wow.
So we really do have to pay attention and go ahead and get our flu shots this year.
Yeah. So do I need to get a flu shot again this year? Now, I get them every year, but do I need to get one again this year?
Yes, this is one of those viruses that actually does mutate. So it changes almost every year. So every year when they create the flu shot, they're creating it based on what they know is in the current flu that's flying around the world.
Got it.
Yeah.
So that's why, because I was like, I got one last year, and I do it every year because, it's required, I want to make sure that I'm covered. Now, this, I know everybody wants to know this question. If I get the flu shot, will it give me the flu?
That is a great question, and I understand why you ask it. No, the flu shot will not give you the flu. Typically, it takes about 2 weeks, though, before the flu shot is really active. So if you wait until late November, you may have already been exposed to the flu. And so you may get the shot and experience flu-like symptoms or have the flu, but it's not related to the flu shot in particular. It's because it takes a little bit of time for it to really build up in your system. So you really should try to get the flu shot early fall if possible.
So now's the time.
Now is the time, yes.
So who should get it? I mean, how old? I mean, how young? Who should get the flu shot?
Everybody over 6 months of age. Yeah, everybody. And those children who get it, who are less than 6 months, they're going to have the immunity from their moms. So if the mom gets the flu shot, then the baby will still be protected.
Got it. Now, should pregnant women get it? Because I know, we can't use a lot of medicines for pregnant women.
Yes, it is very important that pregnant women get flu shots. The reason would be because there's so many changes in your body when you're pregnant. Like there's immune system changes, so you're a little more susceptible to infections. Your heart could be challenged, your lungs could be challenged. And when you have the flu, all of those things are going to be further impacted. So it's really important for pregnant moms to get their flu shots.
Got it. Is it dangerous for pregnant moms though?
No, there's been plenty of studies that have shown thousands of women that have gotten flu shots and had no issues, and the babies are fine. And it also does provide immunity for the flu for the children also up to 6 months.
So as the director of pharmacy, what are some things that we can do to stay healthy this winter?
In terms of this winter, I would definitely say find activities inside the home that make you move around. So maybe put on your favorite music while you clean up. Maybe this is an opportunity to tackle some projects around the home that you haven't had a chance to do that cause you to do a little more strenuous things in the house. Mm-hmm. You're going to have to try to find a way to do things that get your blood pumping, your body moving. You can do dances with your kids. If you're a person who doesn't have other people in the house with you, you can get on a video or like a FaceTime with people and do an activity together. But it is really, really important as it gets colder and the weather gets yucky and we don't want to go outside as much to still be active during the season. Mm-hmm. You want to get all of your rest. You want to drink all of your fluids and you want to take your vitamins. Mm-hmm. And if you're not, and then also we would say eat well. Eating well is really different. It's typically a challenge during the winter months because people want comfort food. But you can, if you're going to do a creamy soup, add a bunch of vegetables to it. Mm-hmm. Just really try to find ways to make sure that you're getting all your fruits and vegetables in.
Got it. I know this whole quarantine thing has us snapping, and just because we see it, we want to eat it. And, we're binge watching. So we're sitting on the couch, but you're right. We have to get active and get moving. With the warmer weather, it was easy to just, walk outside as long as we were socially distanced. But now it's a little different in the winter, but we have to still be proactive at doing those things. So I like that. I appreciate all of this information. For more information, I know we can reach out to AmeriHealth if you are a member at 202-216-2318. That's 202-216-2318. There's a list of pharmacies that they can give you if you need to get the flu shot, and ways that you can get transportation if you need it so that you can get it as well. So I really appreciate this. Thank you, Dr. Davis. I appreciate you.
Thank you. Take care.
All right.